I'm Dr. Jim Walter. The most frequent shoulder injury that we see and treat surgically would be between either rotator cuff injuries, rotator cuff tears, versus shoulder instability, shoulder dislocations. Young athletes in contact sports have a higher propensity for shoulder instability. The most common is an anterior shoulder dislocation. Unfortunately, when a young athlete has an anterior shoulder dislocation, they have approximately a 70% recurrence rate, meaning if they go back to their sport, it's going to come out again 70% of the time. So we are actually discussing with athletes and their families doing surgery to repair their unstable shoulder after the first dislocation. That's a change, whereas in the past, we generally recommended non-surgical treatment for first-time shoulder dislocations and only talked about surgical interventions if it happened a second time. The problem is the athlete can do further damage to their shoulder with each subsequent dislocation, and since the statistics are that they're probably more likely to redislocate their shoulder rather than less likely, that's why we're evolving to more aggressive treatment of first-time shoulder dislocations. The most common is an anterior shoulder dislocation. It is an arthroscopic surgery that has athletes back to their sport in approximately 4 months. We simply go in and arthroscopically reattach the tissue or labrum torn away from the bone, the glenoid, and by reattaching it, we are stabilizing the shoulder. Arthroscopic surgery is a less invasive, minimally invasive technique. When we used to do shoulder stabilization procedures decades ago, before the arthroscopic techniques had been developed, patients wound up with a large scar and usually stayed in the hospital for a day or two because it hurt so bad. By doing it arthroscopically, we can get very similar, if not better results, and patients go home the same day and have some pain, but much less than they did with the older open techniques.